Good evening and welcome. You're watching the 8 o'clock news. I'm Sonal Mehrotra Kapoor. Let's take you through the top stories of the day. Amidst the UP turmoil, the Chief Minister Yogi Adityanath is in the capital. He had a 90-minute meeting with Amit Shah today. Will be meeting the Prime Minister tomorrow. After joining BJP, when questioned on ideology, Prasad tells NDTV, what about alliance with Sena? Kapil Sibal from the Congress party attacks back, says no ideology, just personal gains is Prasada Ram mentality. Bihar fixes death tally. India sets a grim global record, over 6,000 deaths after Bihar adds almost 4,000 to the tally. In fact, Bihar, Maharashtra missed the deaths almost 72 to 77% over the daily deaths. Tamil Nadu amongst the lowest 5 states to vaccinate. In the same rank as UP and Bihar right now. Doses supply doubled. Pack to pick up is what officials are saying. First vaccinate, then can reopen shops. Bhopal's new move to push in vaccination. And door-to-door vaccination in Kerala, over 1.6 lakh beneficiaries, all patients. Asian Games champion Yo Singh is now no more. Filmmaker poet Buddhadev Das Gupta also dies. Let's begin with the numbers. Now, until yesterday, India's daily death count was just around 2,000. Suddenly today, it went over 6,000 deaths, the single highest in the world. How come? Well, that's because Bihar revised its COVID death figures to over 9,000. The government admitted that the number of deaths across the state in the pandemic were 9,375 and not the almost 5,000 figure they had earlier pointed out. Now, this correction happened after the Patna High Court asked for an audit of the casualties amid allegations that the Bihar government was hiding the scale of infections and deaths in the state. Remember those shocking visuals that had come of bodies floating in the river and washing up the banks near Buxar last month? Well, the new figures now imply that while 1,600, and that's the figure on your screen right now, while 1,600 people died of COVID in Bihar between March of 2020 to 2021, from April onwards to June 7th, the number has gone up 6 times. And in contrast to Bihar's one-off addition to the backlog deaths, if we can call it that really, Maharashtra has been doing this almost every day. It adds deaths from week or 2 weeks ago, which has been missed in the daily count. Now, look at this data. The contrasting figures really over there. We'll talk about Bihar first, where the daily deaths were earlier about 5,458, backlog added, total cases went up to almost 72%. Maharashtra, daily deaths about 25,900 and counting, backlog of about 19,900 added. That meant it went up about 77%. However, a reality check by NDTV found out that the ratio of backlog cases roughly the same between Bihar and Maharashtra.
It was the shocking visuals of these dead bodies in the Ganga near Buxar last month, leading the Patna High Court to order an audit of the COVID death count. The result is out. The government accepted an extra 3,951 deaths, taking its total up by 72%. These 3,951 deaths took place in April-May during the ferocious second wave.
छिपाए नहीं, बताए, ये हम लोगों ने खुजवाया और हमारी सरकार की मंशा बहुत साफ है, माननीय मुख्यमंत्री जी की इच्छा है.
But the leader of opposition, Tejasvi Yadav, tweeted that actual deaths are 20 times more. The state government says it's open to more revision of toll if it's certified by authorities concerned.
हमारी मंशा ये है कि हम हर उस परिवार और व्यक्ति की तलाश करें जिसकी कोरोना पॉजिटिव होने के कारण मृत्यु हुई, और इसी क्रम में पिछले 15-20 दिनों से ये सारे जानकारी इकट्ठे करने के प्रयास जिला प्रशासन के स्तर पर किए गए।
Many experts have said that COVID deaths in India are being underreported by a large extent. The Bihar government's move at a backlog of as many as 72% more deaths is a step in the right direction. As experts say, it will help improve the fight against COVID. Now the big question is, if Bihar underreported deaths during the second wave by so much, what about other states? With cameraman Habib Ali, this is Manish Kumar for NDTV.
As one of adding deaths it has missed, Maharashtra has been doing this almost every day. Since the second wave took off in March, Maharashtra added almost 22,000 additional deaths. These deaths, which took place 1 or 2 weeks earlier, are added to the daily deaths. In this period, daily deaths have been almost 28,000, which means the backlog death count almost 78% more. For example, on Wednesday, the state reported 261 deaths and an additional 400 deaths were reconciled as per the state health bulletin.
There is nothing like under-reporting. There is no intention for under-reporting. We are very fair, we are very transparent, we are very honest. Only thing is might be because of some data entry persons, those who have, because of their negligence that might have happened. We will correct it if happened, and we will ensure that this should not happen henceforth.
But after allegations by the opposition that the government is hiding the true death count, the Health Ministry has given orders to all district collectors to give data of all unreported, missed, delayed death reports within 48 hours or else face action.
मुंबईत तरी आपल्या मृतांचे आकडे लपवले जाणार नाहीत. मुंबईत कुठेही नदी नाही की गंगा नाही की ज्याच्यामध्ये उचलल्याने मृत्यूदर टाकला. कारण एक नाही तर दोन नाही 3 ठिकाणी त्याची नोंदणी होते आणि त्या 3 ठिकाणच्या नोंदण्या तुम्ही कशा काय न दाखवू शकता.
To be sure, Maharashtra's frequent revisions to the number of death figures meant few spikes to the all-India figure like that triggered by Bihar today. In Mumbai with camera person Sanjay Mandal, this is Purva Chitnis for NDTV.
And let's shift our focus to Tamil Nadu now. Said to be a robust state with a brilliant healthcare system. But guess what their vaccination figures are? Well, percentage-wise, they fall in the bottom 5 states in the country. In fact, they rank up with states like UP and Bihar. Why is that happening? The next story explores.
As people queue for a vaccine in Chennai, questions have surfaced over why a more developed state like Tamil Nadu has fallen behind in India's vaccine race. Tamil Nadu was right at the bottom, along with states like Jharkhand, Uttar Pradesh and Assam, way below states like Gujarat, which with a comparable population has covered more than double, 20.5% with a single dose, and Kerala, which has achieved 22.4% coverage. Authorities say the poor showing was because of initial vaccine hesitancy, and now things are better. Between January and February, Tamil Nadu could administer only 4.57 lakh doses together, but the rate of vaccination rose by more than 5 times in March, crossing 28 lakh doses that month, and nearly 7 times in May, crossing 30 lakh doses. The state government also blames the centre of supplying vaccines only according to utilization and not in proportion to population. Now they claim there is high awareness and many takers, but no vaccines in the state, except just over 1,000 doses in Chennai.
Now we personally feel that it should not be held against Tamil Nadu. Now there is no vaccine hesitancy. So when there is no vaccine and the people are taking it in a big way, so we need to calculate it based on the running last 3 days or 4 days and supply. Government of India has more than doubled the allocation from May to June.
Chief Minister M.K. Stalin has tacitly blamed the union government of dispatching more vaccines to BJP-ruled states with a lesser population. the centre has denied this. While vaccine hesitancy did slow down Tamil Nadu, the second wave has led to a sharp rise in demand for vaccines. As Tamil Nadu remains nearly COVID vaccine dry, the state demands 2 crore doses every month. That's 6 lakh doses every day. And pressure is now mounting on the central government to dispatch more to this southern state. In Chennai with Shah Vijay, Sam Daniel, for NDTV.
All right, so while Tamil Nadu is a bit of a disappointment right now, Kerala seems to be leading the way once again, this time with providing vaccinations at doorsteps for those who are the most vulnerable and sometimes the most underprivileged as well. Bedridden patients are now receiving vaccines at their homes, all thanks to the incredible ASHA workers of Kerala. Sneha Merikoshi joined them on this journey.
80-year-old Anandavali getting her COVID vaccination at her home in Thiruvananthapuram. She is partially paralyzed and under the state's palliative care. Her source of livelihood, 1600 rupees monthly old age pension, and her daughter a daily wager. Across the state, medical teams have to vaccinate over 160,000 bedridden palliative care patients at their homes, and they say they've done their homework on each one's condition.
COVID പങ്കെടുക്കാൻ പറ്റി ഇങ്ങനെ ഈ ഒരു കാലഘട്ടത്തിൽ വർക്ക് ചെയ്യാൻ പറ്റിയത് തന്നെ നമ്മളെ സർവീസിൽ ഏറ്റവും വലിയ ഒരു ഭാഗ്യമായിട്ടാണ് കാണുന്നത്. നമ്മളെ കൊണ്ട് ഇത്രയൊക്കെ പറ്റുമല്ലോ എന്നുള്ളൊരു സന്തോഷം, നല്ല സന്തോഷമുണ്ട്. ഫാമിലി ഫുൾ സപ്പോർട്ടാണ്. ഇപ്പൊ തന്നെ ബസ്സിൽ ഒത്തിരി ദൂരെയാ മക്കളെ കൊണ്ടാക്കി തിരികെ വിളിച്ചുകൊണ്ട് പോകുന്നത്. അവരാ കറക്റ്റ് സമയത്ത് തന്നെ കൊണ്ടാക്കി തിരികെ കൊണ്ടുപോകുന്നുണ്ട്.
So far, 1,000 have been inoculated in 1 week. With every panchayat's community or primary health center as the nodal point, each medical team comprises of at least palliative care nurses, a junior health inspector, ASHA worker and a local body representative.
We already have the line list of these patients, and we have already sorted out the adverse reactions and the drug reactions among them, also the usage of anticoagulants among them.
Registrations for these beneficiaries are on the spot, done by the team themselves. Most of the bedridden beneficiaries we visited today are from economically backward families, a grim reminder of the mammoth challenge that lies before us as a nation to ensure sufficient vaccines and timely access. This, even as large part of India still struggles to get their vaccine slots. With camera person SP Babu, Sneha Koshi for NDTV.
Meanwhile, markets in Madhya Pradesh's capital Bhopal reopened from today after easing of the coronavirus-included curfew. While the numbers are down, their concerns remain about vaccination or perhaps the lack of it. And the story is the same. Vaccine availability is an issue in urban centres, while in rural areas, they are hesitant.
Tika Lagao, Dukaan Khulwao. A unique initiative by the Madhya Pradesh government for allowing markets to reopen, which requires that all shop employees be vaccinated before opening their commercial establishments. Markets have been allowed to function from 10 a.m. to 8 p.m. 6 days a week, and not being vaccinated could result in the sealing of shops.
जैसे ही हम लोगों ने जानकारी ली वैसे ही आज वैक्सीन लगवाने आ गए। अगली वैक्सीन भी अगले 40 दिन में दूसरा डोज भी लग जाएगा।
वैक्सीन लग जाए तो दुकान पे आना, बिना वैक्सीन के रखेंगे नहीं आपको।
वैक्सीन कर देंगे तभी दुकान खोलने दी जाएगी, नहीं तो दुकान सीज कर दी जाएगी।
If the Bhopal experiment is successful, the government hopes to adopt it in the entire state and overcome vaccine hesitancy by linking it to livelihoods.
कल हमारा भोपाल में बहुत सफल प्रयोग रहा और ये कैंपेन की शुरुआत या सुझाव व्यापारियों द्वारा ही दिया गया था। इसमें दबाव नहीं है, परंतु ये बात सही है कि यदि वैक्सीन लग जाती है तो कोरोना संकट बचता है। कल 40,000 लोगों को जिस प्रकार से एक दिन में हमने वैक्सीन लगाया तो निश्चित रूप से हम इस पर विचार कर सकते हैं।
In Niwadi district, the police launched a unique campaign to honor those who have received the COVID vaccine. Tricolor badges that say, "I am a patriot as I am vaccinated." And those who have not been vaccinated were handed posters with skull marks and the message, "Mujhse dur rahein, maine abhi corona ka tika nahi lagwaya." They were also asked to read the message aloud and take an oath promising to get vaccinated within 2 days.
Analysis of the COVID vaccination data of 52 districts in Madhya Pradesh clearly depicts COVID vaccination booking mechanism heavily loaded in favor of the urban technology-savvy population in districts like Indore, Bhopal, Jabalpur and Gwalior. On the other hand, the predominantly rural population are laggards and worst performers in terms of vaccination in the state. In Bhopal, with camera person Rizwan Khan, Anurag Dwari for NDTV.
On to the big political news of the day. Now, Chief Prasada's exit, that dominated political discourse even today. But will Congress's loss turn out to be BJP's gain? With UP election just about 6 months away, what exactly does Jitin Prasada bring to the table? He lost his last 3 elections after all. Well, BJP insiders believe that he will help override what some say is an anti-Brahmin sentiment against the UP government led by Yogi Adityanath. Alok Pandey reports on, is that really the case?
As UP Chief Minister Adityanath heads to the capital and the BJP attempts damage control in Uttar Pradesh, a point of contention has been the Brahman Thakur equation in the BJP, especially after 4 years of Adityanath's rule. The UP government is battling a perception of being anti-Brahmin. Mr. Adityanath belongs to the Thakur community. Jitin Prasad's entry into the BJP is not without context. A deluge of wishes by UP BJP leaders for the latest Brahmin import. Mr. Prasad has been active in raising issues for the state's Brahmin community, a community estimated to be a sizable 10% of the state's population, a big vote bank. Thakurs, the other major power center in the state, are around 8%.
ब्राह्मण चेतना परिषद का मैं संरक्षक हूँ, चला उसे कोई और रहे। और अब मैं समझता हूँ जहाँ मैं हूँ, मैं और मजबूती से जहाँ अन्याय हो रहा है और किसी समाज का, सिर्फ एक समाज की बात नहीं, मजबूती से उनके साथ खड़ा होके उनके न्याय और उनके अधिकारों की लड़ाई लड़ सकता हूँ।
While the BJP maintains an anti-Brahmin sentiment is opposition propaganda, balancing caste equations is playing heavily on the party's mind. An attempt could be made to present a Brahmin Thakur united front ahead of the 2022 assembly polls.
I was listening to your commentary, but I would like to bust this theory of caste politics that you were trying to enunciate. Because you see the elections, Lok Sabha elections of 2014, 2019 and the Vidhan Sabha of 2017 in UP and the country have clearly busted this theory. It really negates the theory of caste polarization.
This is all Prasadaram politics. Means you want to fight elections not on the basis of your convictions towards an ideology, but your conviction that I might get something personally.
Sources in the BJP say that Jitin Prasad's induction into the party may not be as much about consolidating Brahmin votes in Uttar Pradesh as it is about showing the Gandhi family in poor light, because Mr. Prasad was extremely close to Rahul Gandhi. Party sources also say there are already many tall Brahmin leaders, both homegrown and imported, in the UP BJP. One recent example, Law Minister Brajesh Pathak, once very close to BSP Chief Mayawati, whose letter this April to his own government's officials criticizing COVID arrangements had exposed the Adityanath government's big claims on COVID control. As Adityanath and Narendra Modi meet in New Delhi and iron out the party's internal differences, managing caste dynamics in India's most populous state ahead of elections is a definite priority. With Saurabh Shukla, Sunil Prabhu and Sanket Upadhyay, this is Alok Pandey, NDTV.
So along with the high-profile recruit from the Congress party, what else is happening in UP? Well, the UP Chief Minister Yogi Adityanath is in Delhi for 2 days. This is important as it comes in the backdrop of criticism within the UP BJP of Adityanath's handling of the COVID pandemic and BJP's poor performance in the Panchayat polls as well. Today is day 1. and he had a 90-minute-long meeting with Amit Shah. Tomorrow, he meets the party president and, importantly, the Prime Minister as well. Remember, all these three people that he will be meeting have been, in the past 1 week, getting feedback from several other leaders in UP. So, will there be a change in the UP leadership? Is that likely? Apparently not, but Sanket takes you through what else might be BJP's game plan.
Yogi Adityanath is in the national capital. He's meeting, he met Amit Shah. He's going to meet the Prime Minister tomorrow. He's also expected to meet the party president. But what really is happening? We've got some inside track on what's happening in the Bharatiya Janata Party. Let's quickly take a look. So Yogi Modi meet. What's really the way out of this UP mess? The information by way of sources, the BJP central leadership is actually worried about leadership in Uttar Pradesh. It is very clear. The central leadership has sourced its information about this, about the situation from several sources, from MPs, MLAs, ministers, the RSS's state leadership, as well as Mr. Dattatreya Hosabale. BJP General Secretary Organization, Mr. BL Santosh, too, had submitted his report. All these reports seem to point at some form of resentment and also inability of Yogi Adityanath in taking everyone along. That's the common sense of all these reports. These reports also say that Yogi is inaccessible to MPs and MLAs from the state, and the mishandling of the COVID wave led to these differences coming out in the open. So that's the point that we've got or gathered as of this moment. All right, so what is the possible compromise formula? Let's tell you that also. Yogi will not be replaced, as he is the tallest face in BJP, which is something that we have reported. But the party will majorly course correct within the organization and the government. And that will be with the express authority and approval of the Prime Minister as well. There will be an attempt that will be made to make Yogi cabinet and party, the whole structure, more accommodating, because that was the criticism. Central leadership will press for A.K. Sharma to be inducted in the cabinet. Remember, he's a Modi man. He'll be inducted. BJP will attempt to balance the caste equations within the party organization. There is also a possibility of replacing State President Swatantra Dev Singh, he's an OBC leader, with perhaps a Brahmin face, so that there can be a Brahmin Thakur coordination right at the very top in the state of Uttar Pradesh for the BJP. But Yogi also has a plan of action. Yogi has come with documents to the national capital. Yogi is expected to present his track record to the central leadership. The CM is also carrying names of likely probables for the cabinet expansion. He is also trying to explain or convince the central leadership that no, there was no problem as far as handling of COVID-19 is concerned. The total strength of Yogi's cabinet is 60, present strength is 42. There are 18 positions vacant. So there will be discussions on how these 18 vacant positions need to be filled. Yogi is also likely to suggest names for changes in the structural organizational structure, and he's also likely to press hard for not removing the party chief, Swatantra Dev Singh. So that's really the action plan as far as UP is concerned.
All right, so lots happening on the UP front now, but shifting our focus to Mumbai, where in a tragic incident, 11 people have died after a building collapsed in Mumbai following heavy rains on Wednesday. It's a blame game among the multiple authorities on who is accountable for this. At least 7 others even received injuries. Locals joined the search team and helped in rescue the injured and transported them to the hospital. And Asian Games gold medal winning former boxer from the Northeast is Dinko Singh, died this after he had battled COVID last year.
Asian Games gold medal winning former boxer Dinko Singh died on Thursday after a long battle with liver cancer. He was 42 and had been fighting the disease since 2017. The Manipur-based former boxer even fought COVID-19 last year. As soon as the news of Dinko's demise broke, condolence messages poured in from all corners, including Prime Minister Narendra Modi, who called the late boxer a sporting superstar. Dinko won the gold medal in 1998 at the 13th Asian Games in Bangkok, ending India's 16 years medal drought at the Continental Games. For his outstanding contribution, the Manipuri pugilist was bestowed the Arjuna Award and Padma Shri.
Also renowned Bengali filmmaker Buddhadev Das Gupta died at the age of 77 on Thursday morning. He was suffering from a kidney ailment. He is also a celebrated poet, had won several national awards for his contribution to the Bengali cinema.